Doctors of Reddit, what was your dumbest r/Iamverysmart patient experience? 70-year-old female tripped and fell 2 days ago. She came in with hip pain, but reports after the fall her nose was bleeding. She had landed on her nose. About a year prior her dentist had messed up an infraorbital nerve block and caused some swelling in that region, but that all was resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient I raised my voice and put down an authoritative, "No, you are wrong, just stop it." Med student here. On my pediatrics rotation a mother refused vaccines for her kiddo after educating herself. When prompted as to what she was using as her source, she replied, "My own brain." Lovely. Not a doctor, but am a medical technologist. There are plenty of Iamverysmart moments, but this one was recent. Did a finger stick for a patient, ensured the little cut stopped bleeding, and then put a band-aid on it. Told her to collect a urine sample for testing. Test came back strongly positive, 4+ reading, 4 blood. She complained to the doctor that there is no way she has blood in her urine, and that the blood from her fingerstick must have entered the urine, throwing off her reading. She said it was my fault that I did her blood test before her urine test, and I obviously made a mistake. She repeated the test later in the afternoon, still at 4+. Came back a week later, still at 4+. The look on her face when I told her, "Sorry, ma'am, your result is still positive," was priceless. Registered nurse here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds, diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes in, he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams, "No. No water. He's allergic to water." Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, "Where are we all supposed to sleep?" The whole family, 10 people, were planning to stay at the hospital with him. You can't make this shit up. A related story from my friend, a gynecologic oncologist. Basically a woman had early uterine cancer, but refused surgery. She wanted to explore alternative treatments like coffee enemas and meditation. She somehow managed to get an audience with the Dalai Lama, who told her to go back to Western treatment. Oh, I have 2 good ones that come to mind. Clinical pharmacist here by the way, with one story in the ER and one in the pharmacy. 1. ER. Physician told me this one. 16-year-old boy presented to the ER with an extremely swollen discolored penis. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. He thought that adding blood would help increase his size. His penis was terribly infected, and he was hospitalized for a week or so. 2. One day in the pharmacy, a girl comes to the counter requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each, and was adamant that was how they needed to prevent pregnancy. Not a doctor, but I'm a nurse who worked in the OR at a trauma center. Was doing surgery on a 19-year-old who tested positive for meth and cocaine, who was grilling the anesthesiologist about every drug we were going to use in surgery, because he doesn't like putting chemicals in his body. Gotta stick with that organic, fair trade, non-GMO cocaine. Another tales from a trauma center since you'll like the last one. Guy is trespassing in a junkyard and gets his arms and legs ducked up by a pit bull. Have to clean out all these wounds. Flash forward to 3 AM that night, I get called in to do a case. Apparently the guy left the hospital AMA to go get revenge on the dog, and the dog bit him in the face. breaking some facial bones and poking a few more holes in the process. Classic. My dad is an emergency nurse. He experiences the same thing doctors in the ER do, maybe more so because he's the one in the rooms more often. Anyway, here's a good story from him. I had a patient come in with several pages he printed off the internet. He kinda slammed them down and said, "This is what I have." He had bloating, nausea, vomiting, diarrhea, bloody stool, and fever among other things. He insisted he had schistosomiasis. He was being a real jerk about it, like we're wasting time since he already knew what he had. So, I asked when did he get back from Africa? And he said, "Africa? I've never been to Africa. What the hell would I be doing in Africa?" I proceeded to tell him that schistosomiasis is a parasitic disease one gets while swimming in the Nile River or other rivers in developing countries, like in Southeast Asia. He got pissed off at me because he thought I was being a smartass. He got seen and diagnosed with gastroenteritis, the stomach flu, the bloody stool. He had hemorrhoids. I am a dental student. One patient in particular is pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they did dental army. Last visit was that they had a PhD. The patient will say things like, "Hey doc, do you need me to move my head mesial or distal?" "No. I need you to move your head right." "Hey doc, are these cavities being caused by the anaerobic pathology microbes?" "No. They are caused by you eating snacks all day and not brushing." I've got two stories that stick out in my mind. The first is the mother of a toddler who came into emergency. The kid had cruddy green/bloody stuff coming out of his left nostril, and a lot of redness and swelling of only the left side of his nose and the adjacent cheek. Mom was sure he caught a sinus infection and just wanted some antibiotics. Now I know some kids like shoving whatever will fit into their body orifices, and that this was more than likely given the one-sided nature of his condition. But mom was insistent that he never puts things in his nose. It took some convincing, but I finally got her to let me take a look. Gave a squirt of midazolam in the good nostril to settle him, then dug with some tweezers through the crud until I pulled out a big ol' button battery. It would have been burning his nose for a couple days. Hopefully he healed up well. 80-plus-year-old patient who was declining with multiple diagnoses and about 3 decubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all, by the way. At some point you kind of have to stop being polite and just tell patients/family members bluntly that you don't have time for this shit and what you recommend, and they can do what they want and just document everything. It happens a lot, but she sticks out. Had a young woman with recurring UTIs that began after a recent partner and with no STDs, went through the standard questions trying to figure out what could be causing them, and eventually found out she had been lubricating with jelly. Not KY jelly. The mix-up had literally been a joke on the house. It took me some effort to keep a straight face, but we eventually resolved the problem, and she stopped getting UTIs. Patient had a hard time getting pregnant. Finally conceived but miscarried. Patient has a DNC, so she can try again, this time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment. But she keeps coming back with high levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder, and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She says, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she is on the HCG diet. HCG is the pregnancy hormone. And this was after an hour of the docs saying, "We don't know why you have these constant high levels of HCG in your blood, and we are worried." I work for an optometrist, and it was the month before school started, and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time, since he's nearsighted and basically can't see clearly past 5 inches in front of him, and will definitely need glasses for school. For some reason this caused a switch to flip in the mom, and she spazzed out on the doctor, saying that her son doesn't need glasses, and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out, and that doctors are all con artists trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them, but that she was free to get a second opinion, and gave her a copy of the kid's prescription and sent them on their way. About 4 months later, the lady is back asking for another copy of her son's prescription. Apparently the first semester midterm results were in, and her son failed them all, because he couldn't see the board in his classes and needs glasses. I'm an OR nurse, and I had an oral surgery patient who had a self-reported history of 250 plus various surgical procedures, a list of 20 some allergies, tons of reported health issues, plus her preteen son supposedly had dozens health issues as well. She refused to remove her glasses during induction, started screaming and crying about claustrophobia when we put the mask on her face. She also insisted on taking a stuffed animal to the OR anyway, getting to the point. She was having oral surgery because she told us, insisted, that the last time she went to the dentist they told her not to brush her teeth for at least a year. So she hadn't brushed her teeth in like a year and a half. That was one for the books. Not a doctor, but a patient whose mother was like this. The doctor had to speak to me on the side because of it. My grandmother has Crohn's disease. Very, very badly. It skipped my mother and her brother. When I was 15, over the course of 6 months, I went from being 5 feet 9 and 190 pounds to being 110. I was a skeleton, extremely anemic, and coughing up blood. My mother was convinced it was something else. I forced her to bring me to a doctor, and she spouted off all these possibilities. She then talked about what she Yahoo'd. Not even Googled. Yahoo. About genetics and such. And Crohn's can't skip generations. Well, the doc said, just in case, we're gonna run some tests. Long story short, I have Crohn's in my throat and small intestine. So does my cousin. It just skipped a generation. Where to start? 1. Picture a middle-aged man. His index finger is 5 times the size of the rest of his fingers. It smells. It's leaking pus. There's necrotic tissue. Basically one huge infected cancerous finger. He was a firm believer in not taking any sort of medication, including antibiotics or chemo. Died a few weeks later, but he did manage to tell us we were all idiots before he passed away. 2. Patient was a young child who came in with an extremely high blood glucose level. Once she was stable, we did some teaching and kept her for a few days for observation. For some reason, every time I checked her, her levels would be extremely high, although we were appropriately treating her. Turns out her family would bring her fast food for every meal and hide it in the side table. More teaching and resources were put into place. 3. Had a mom in hysterics, because she was convinced that her neighbors, friends, stepsons, teacher's dog has MRSA, so her baby was going to die. It took everything within me to not tell her that most of the hospital staff have MRSA. But it took 3 hours for me to finally calm her down, after I called infectious control, her pediatrician, gynecologist, and family doctor. Yes, I had to call all these people. Yes, they laughed at me. Yes, she was beside me the whole time questioning their judgment. I love my job, but at times it makes me crazy.